discussion is prostate diseases, and our very special guest is Dr. Haroun Patel, a urologist practicing in Durban. Dr. Haroun Patel, Assalamu alaikum wa rahmatullahi wa barakatuh, and Jazakallah khair for joining me on Medical Files.
Wa alaikum assalam wa rahmatullahi wa barakatuh, and Jazakallah for having me on the program.
Just to introduce our guest, Dr. Haroun Patel qualified as a urologist at Wits University in 1992. He's been the acting head of urology at UKZN from 1993 to 1995. He joined S.I. Hussain and Partners in 1995 to date and is head of urology at UKZN from 2018 to 2022. Dr. Haroun Patel currently practices at the Parklands Hospital. Now, Dr. Patel, I introduced you as a urologist. What or who is a urologist?
Okay, so in simple terms, as you mentioned, my senior partner used to say, it's a human plumber. We deal with all issues relating to the urinary tract in both males and females, and then also any genital issues relating to males specifically. So that's basically broadly what our profession is all about.
Now, I did introduce a topic, a topic for discussion as prostate diseases. But before we speak speak about the diseases, what is the prostate gland and what is its function?
Okay, so the prostate gland is a gland that lies just below the bladder. It's more or less pear-shaped with a hole in the middle, and the urine flows through that hole to the outside. Its main function is to give seminal fluid to add to the sperm, and there may be some other supporting functions, but that essentially is its main function. There may be other functions that we're not quite aware of.
And, what are the most common prostate-related issues that men face?
Okay, so most of the issues tend to occur in the elderly men over the age of 45, 50, and the main issues relate to urine flow. They have different types of symptoms that relate to the flow of the urine, and they generally then present, and the commonest cause in the elderly, well, I wouldn't say 45, 50 is elderly, but let's say people over the age of 45 and 50 tend to start having troubles, and often it's related to the prostate, and we can go through the specifics as we go along.
Now, speaking of the prostate, how can one sort of maintain a healthy prostate?
Look, unfortunately, there's no specific measures that you can take, but, there are a lot of theories about selenium, zinc, pumpkin seeds, and a whole lot of other things, but there's no proven measures that you can take. So really, prostate disease is something I don't think you can stop from happening. It's just one of those things that happen as you get on in age and to varying degrees in different individuals.
How common are these?
I think it's fairly common. Most patients over the age of 50 are going to have some degree of urinary symptoms that bother them. And as you get older, past 60, 70, the symptoms become more bothersome. And I think most men in that age group will tell you that, they can't pass urine as they did before. Not all of it needs treatment, but certainly it needs attention. And then in all of this, obviously, there's a lot of concern about prostate cancer. It's been described as the commonest cancer in males in that age group, and so a lot of patients have fear for that particular problem and often come in purely to get reassurance or to see that they're not not harboring a cancer. So between the symptoms and the worry about cancer, those are the commonest presenting problems in the men over the age of 45 and 50.
And what are the risk factors for developing prostate cancer?
Okay, so for prostate cancer, there are a few risk factors. One is if you've had a family history, a first-degree relative that has had prostate cancer, then the risk of you having prostate cancer is much higher than the average population. Then it was certainly found in black Americans, but I think it also applies to our country in South Africa as well, in that they tend to get prostate cancer earlier and often tends to be more aggressive and at higher risk for the rest of the population. So if you have screening programs, I think those two groups, you should start screening earlier, and we can talk about the screening processes as we go along just now. There are a lot of genetic mutations that come in, like for instance the BRCA genes that they talk about with breast cancer. They're also implicated in the risk for prostate cancer. So those are the main risk factors that people have, and if you fall into any of those categories, you should be screened at least after the age of 40, and certainly not later than 45.
And how often should you be screened?
So there's a big bone of contention with screening, and I don't want to go into a complicated discussion there, except that there was quite a few studies done in the United States starting in about 2013 and then revised in 2018 or 2017, where it was suggested that routine population screening is really not appropriate. And that means that you say every male over the age of 50 should go for a prostate blood test every year. And it was found that you were overdiagnosing prostate cancer and overtreating them. And when we talk about what prostate cancer is all about, you'll find that for many patients, even having prostate cancer isn't an issue, because there are different categories of prostate cancer, and it's generally a slow-growing cancer. So in terms of screening, all men over the age of 50, and if you're in a risk group over the age of 40 or 45, should have at least one PSA to start with. Depending on the baseline PSA, then, if the baseline PSA is very low, one would say repeat the test again maybe in 5 or 6 years' time. And beyond a certain age, they recommend that you should stop screening. So, for instance, if you reach the age of 70, or if your health is really good, 75, and you haven't qualified for a biopsy for prostate, the recommendation is you should stop screening, because like I said, the nature of the disease is such that it's slow growing, and in some patients may never worry them in their lifetime.
But how rife is this particular condition, Dr. Patel?
So prostate cancer has become pretty common, and one of the reasons for that is that it's been screened for. So, as much as I said to you that there were guidelines given in the United States with regard to the screening programs, the reality is that every male that walks into a urologist's room is going to be screened. In fact, a lot of the family practitioners are going to screen for prostate cancer if a man over the age of 50 would come in. And so because of the screening, you pick up a lot of cancer. Not every one of those cancers necessarily require treatment, but once the diagnosis is made, often the options are many. And for many people, once the big C comes up, there's a lot of apprehension, and often they would opt for treatment even though there are other options available.
And I think it affects you psychologically as well.
Exactly.
It messes you up. Just to remind our listeners, this is an interactive program. If you have any questions on prostate diseases for Dr. Haroun Patel, our urologist in the studio, then you may forward them to us via WhatsApp on 060 904 1056 060 904 1056. Just to remind you that doctors and guests on the Medical Files program will help you with any medical problems that you pose by giving you advice on air. However, they do not have your full medical history and have not examined you. Please verify the advice given to you on air with your regular doctor who knows your medical history, your allergies, etc. Neither the doctors nor the relevant radio station nor the Islamic Medical Association of South Africa will take any responsibility for any adverse reaction caused by the advice given on Medical Files. Yes, as I said, we are discussing prostate disease, and Dr. Haroun, the first question has come through. It says, do lycopene supplements and lycopene-rich foods like tomato sauce, tomatoes, etc. help prevent prostate enlargement?
So look, there was a discussion once that the Mediterranean type diets, which specifically what you talk about, tomatoes and the likes, would lessen the risk of prostate cancer, not necessarily prostate enlargement. Whether that still holds true today, I'm not sure, but there definitely is a discrepancy in the prevalence of prostate cancer when you go further east as opposed to when you go further west. And like I said, that particular diet with rich in tomatoes, and it was thought to be protective for prostate cancer in particular, but not necessarily prostate enlargement.
Thank you for that, Dr. Haroun Patel. Now, what are the symptoms of prostate cancer and how is it diagnosed?
Okay, so I think the first thing to emphasize is that generally people that have symptoms with passing urine are not related to prostate cancer necessarily. Most of those symptoms relate to what we will discuss later called benign prostatic hyperplasia, which is the enlargement of, in simple terms, is enlargement of the prostate with age, which is generally not cancerous. So when you have urinary symptoms, generally they often related to that particular instance. Most prostate cancers are picked up incidentally, and they're picked up incidentally when patients are worked up for the urinary symptoms that are normally due to prostate enlargement that's not cancerous. And the way to do that is two. One is a blood test, which is a PSA, which you'll probably ask more about later on, which is done as a routine in men over the age of 50. And then the dreaded finger test, which most people don't want to have done, where we check the prostate through the back passage. And I think it both need to be done. It's not necessarily one or the other, because if either one of those are abnormal, if the PSA is abnormal or if the physical examination is abnormal, then that warrants further investigation to exclude the possibility of prostate cancer. And I must just emphasize that an abnormal PSA or abnormal finger exam doesn't mean you have prostate cancer. It means you need to investigate it, because a good percentage of patients may not have prostate cancer, even those tests are abnormal.
And what are the treatment options for prostate cancer, and what are the side effects?
Okay, treatment options, and I think I'll just digress a little here. I think you need to understand the natural history of prostate cancer to understand why there's a whole bunch of treatment options that I will discuss. As a rule, prostate cancer is a very slow-growing cancer. If you diagnose early prostate cancer today, the chances are it's unlikely to affect your life for the next 10 to 15 years at least. Prostate cancer is graded into different risk groups as well, so that also influences the progress of the disease. But by and large, prostate cancer, if picked up early, is very unlikely to cause any effect on your life for at least 10 to 15 years from diagnosis. Bearing that in mind, you will then obviously tailor the treatment according to the patient's age, according to the patient's other medical problems, and obviously, most importantly, according to the patient's wishes. Because as much as you might try to convince the patient that treatment's not necessary, if it's psychologically going to cause them a lot of stress, you may choose a different route. So that's the background to deciding as to what prostate cancer treatment is. In terms of treatment, if you pick up prostate cancer early, you have 4 options. The first option is what we call active surveillance. And that's something that's become very prevalent in the last few years because it's slow growing and because there's a feeling that there's over-treatment. So in a patient with a very early prostate cancer, we also grade it into 1 to 5 grades. And so the very good grade prostate cancer, those patients can be watched and followed up carefully, and treatment only instituted when there's progression to a higher stage. And what that does is it takes away the complications of surgery or radiotherapy or any of the other modalities, because all treatments do have side effects and complications. So that's the first form of treatment for the very early prostate cancer. The next option are 2, the main ones, and that is surgery in the form of what we call a radical prostatectomy, where the entire prostate is removed. And the other one is called radiotherapy. And the common way of delivering the radiotherapy to the prostate these days is what we call brachytherapy. In other words, it's where the actual radium seeds, like the size of a rice grain, are implanted directly into the prostate. And the benefit of that is that it gives you a high dose of radiation to the prostate with minimal side effects to the surrounding tissue. And the third option is a little bit different from active surveillance, is what we call watchful waiting. And that's in a very elderly patient or patient with a lot of medical problems, where we decide, even though the prostate cancer is picked up early, we're not treating at all, because we don't believe the patient will live long enough for the cancer to worry them in their lifetime. And in those patients, we follow them up. If they happen to live beyond our expectations, we then control the disease when it has progressed. But generally, those are patients where slightly different from active surveillance. Active surveillance, we're delaying treatment to a later date. Watchful waiting is where we decide we're not treating based on patient's age, patient's other medical problems. So those are the 4 modalities of treatment that we have for prostate cancer right now, which are used commonly.
2 questions come in. The first is, what is green laser light therapy?
Okay, green laser light therapy is a form of laser that is used for prostate enlargement, not for cancer.
Okay.
So patients that have issues with passing urine, and if we've tried conservative measures and they don't necessarily respond, then you have a variety of options to treat those patients, one of them being the green laser light treatment, which is not that popular anymore because there's a newer types of lasers around today. Those were available maybe a couple of years ago, but it's still one of the modalities that can be used, and it's a less invasive way of resecting the prostate.
And the second question, which comes from the same listener, is prostate artery embolization a good option over surgery?
Prostate artery embolization is an option. It's not the first line option. I've just recently read an article on it, and it's not going to give you the same outcome in most patients as surgery or either in the form of conventional prostate scrape or laser is going to give you. It does, however, work. It's expensive. Medical aids often don't pay for it because it's not regarded as a first-line therapy and usually reserved for patients that don't want surgery or patients that are not fit for surgery, because that is done often under sedation, and it basically blocks off the blood vessels to the prostate, causing it to shrink. So it does work reasonably well, but it's not going to give you the same outcome as you would if you do the conventional scrape or the laser treatment.
Mm-hmm. Now, there's a whole host of questions coming via voice note from one of our listeners, and unfortunately I can't play those voice notes. So if you want to send us questions, you can forward them to us. You can just type them and send them off. Send them over to us. You are listening to Medical Files. We are discussing prostate diseases, and our special guest is Dr. Haroun Patel, a specialist urologist who practices at the Parklands Hospital in Durban. Dr. Patel, another question is coming. Do PDE5 inhibitors like Viagra work for erectile dysfunction problems following prostatectomy for enlarged prostate?
Okay, so generally the erectile dysfunction that tend to occur usually after surgery for prostate cancer. So the PDE5, as you talked, it's basically the Viagra family of drugs. I'm using Viagra not because I'm punting that product, but because most people know that name pretty well. But they generally use more for the erectile dysfunction tends to occur mostly in the group of patients that have surgery for prostate cancer. And yes, it is used. Often they start a little before and they continue after, and it does work in a big number of patients, but not all patients.
Another question comes in. What about Rhizome water vapor treatment for treatment of the prostate?
Okay, Rhizome is available. It's available in Durban. It's a good form of less invasive or minimally invasive surgery for prostate cancer. So a lot of minimally invasive treatment modalities have come up in the last few years, Rhizome being one of them. So Rhizome is basically steam therapy that ablates part of the prostate. It's not as effective as laser and conventional scrape, but it is an option for younger patients that want to try and preserve ejaculation, because one of the problems with the other forms of therapy is that when you do ejaculate, most patients find that the semen goes into the bladder and doesn't come out in front. So it's a sort of a dry ejaculation. And so Rhizome does preserve it to a larger degree than the other modality of treatment. It's patients that are high risk that won't tolerate conventional treatment, and obviously patient's choice. Again, it's not covered by many medical aids simply because it's not first-line therapy. It's pretty expensive, but it does work reasonably well, but it's not equivalent to laser and conventional scrape therapy.
Now, can you discuss the latest developments in prostate cancer treatment?
Okay, so prostate cancer, as far as the treatment of early prostate cancer, I think not too much has changed in the last 15 to 20 years. The treatment option that I spoke to you about early on in terms of surgery and brachytherapy. So the brachytherapy may be something new, but not new like in recent years, but more like the last 10 or 15 years. Prior to that, they used to use what most people experience, external beam radiotherapy, where the radium was delivered from outside the body, focused into the pelvis. And obviously the side effect profile was a bit better, and the dose that you could get in the prostate wasn't the same as you could with the brachytherapy. So that would be reasonably new, but at least about 15, 20 years now. What has changed in surgery is that the advent of, most people have heard of robotic surgery. Mm-hmm. And robotic surgery, again, has been around for long, maybe more than 5 years, if not longer. And that's minimally invasive surgery where the surgeon operates from a console. They put ports into the patient, and the instruments are manipulated from a console on the side of the bed, and it helps to better visualize the prostate, and the precision of the surgery is better. Outcomes very similar to open surgery if done by a good open surgeon, but certainly the recovery period for patients with robotic surgery is much quicker than open surgery. And we've just acquired, not we, but KZN has just acquired a robot recently. Previously, all robotic surgery was going to Gauteng and Cape Town and Port Elizabeth. So I think in the next few months, the robotic surgery for prostate will take off in KZN as well.
And how's been the success rate in the other provinces?
It's a successful op. It's just doing the same op we did previously, in the open form, but through small incisions. Mm-hmm. The outcomes, like I said, if you compare a good robotic surgeon to a good open prostatectomist, the outcomes in terms of cure rates and continence, meaning control of urine and erectile dysfunction, is similar. And the success rates have been good with the robotic surgery, but there's a learning curve. So all surgeons need to go through an accreditation program before they can use the robot, because it's quite a different form of surgery. But outcomes are very good when done in the right hands.
Thank you for that, Dr. Patel. We're going to be taking a short break, but when we come back, just consider this question has come through. Does taking 5 milligrams of Cialis help to reduce enlarged prostate? But we'll talk about this after that break, inshallah.
Welcome to Simplex Radio. Visit our showroom for the full range of car audio. Our TV department carries top brands with quality LED panels, full HD to Ultra HD, and now the experience of Super Ultra HD. Visit our theater rooms and transform your home with brands like Onkyo, Integra, Denon, Boston Acoustics, Yamaha, and more for quality audio visual experience. Now available, full range of home appliances. A one-stop shopping experience. Call 031 306 4029 or Kenilworth Park, 202 Brickfield Road, Overport. Simplex Radio, the name you can trust.
Sunnah a Day, proudly brought to you by Sunpick, 100% pure sunflower cooking oil. Sunpick, cook more with less.
Sunnah a day. It is sunnah to always have vinegar and honey in one's home.
Sunnah a Day, proudly brought to you by Sunpick, 100% pure sunflower cooking oil. Sunpick, cook more with less.
Imagine this. You're putting together a 7-color meal, from the creamy pasta to the glazed carrots and flavorful onion gravy. This entire meal is made with our 100% pure extra virgin olive oil from our La Familia range, bringing outstanding quality and taste to your kitchen. Shop La Familia 100% pure extra virgin olive oil at any leading supermarkets near you. La Familia, heart of the home.
You're listening to Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faisal M.J. Suleiman. We are discussing prostate diseases, and our guest this evening is Dr. Haroun Patel, a urologist practicing at the Parklands Hospital. And if you have any questions on prostate diseases, then you may forward them to us via WhatsApp on 060 904 1056. Now, Dr. Patel, just prior to taking the ad break, I did mention that the question that came through: does taking 5 milligrams of Cialis help to reduce enlarged prostate?
Okay, so it's a good question. The 5 milligrams of, what was it you said? Cialis, yes. Cialis. So it is used essentially for erectile dysfunction, but it does improve the flow. It doesn't shrink the prostate, but it does decrease the tension in the prostate, because it works both for erectile dysfunction and in the prostate by relaxing the smooth muscles in the prostate as well as in the blood vessels for erection. So yes, it can be used for both in those patients that require the daily dose of 5 milligrams of Cialis. Tadalafil is the generic name that is used, and there are other drugs on the market.
Does taking I asked you this question. Can doctor compare Urolift to other therapies for prostate enlargement, and what is the gold standard?
Okay, Urolift is basically, it's like a stapling device. It's used to staple the prostate out against the capsule to open up the passage. Again, it's one of those minimally invasive treatment options that have been developed over the years for patients that are not necessarily fit enough to undergo the conventional surgery. They work reasonably well. It's not available in this country, to the best of my knowledge. The gold standard still is, right now, it's basically the conventional scrape that they talk about, what we call a transurethral resection of the prostate, and laser therapy, specifically the holmium laser enucleation of the prostate, which is now becoming quite popular as well. So those are the really gold standards for treating prostate disease and would be the best lasting outcome as opposed to any of the other modalities, but there is a place for every one of the others as well.
Let's just move to benign prostatic hyperplasia, BPH. What is BPH and how does it differ from prostate cancer?
Okay, so BPH is actually the disease that is most prevalent in men over the age of 45, 50. And essentially, it's an enlargement of the prostate gland with age. And as I spoke to you earlier on, imagine the prostate as a little pear or chestnut below the bladder with urine flowing through the middle. As it enlarges, it restricts the flow of your urine because it's compressing the urinary tube. And so that effectively is what benign prostatic hyperplasia is all about. And it affects men to varying degrees. It enlarges to different sizes in different individuals. And the one thing important to understand is that the degree of obstruction is not proportional to the size of the gland. Some patients have pretty big prostates with very little symptoms, and others have smaller prostates with very significantly more symptoms. So it's got more to do with the tension in the prostate gland. As I explain to my patient often, it's like the tension in a spring. Some springs are very tightly wound and causes a lot of obstruction, whereas other patients may have big spring, but it's not as tightly wound, and so will give you symptoms, but to a lesser degree. And that effectively is the source of the patient's troubles with prostate. The effect it has on the bladder we can talk in a little while, and how it affects what sort of symptoms we can talk as we go along.
And my next question to you was, what are the symptoms of BPH and how is it diagnosed?
Okay, so BPH is basically, so the symptoms really are the degree of discomfort it causes to the patient. And again, this is very variable from patient to patient, and it relates to the tolerance of patients for discomfort. The main initial symptom that most patients would present with is a decrease in the flow of the urine. I remember many years ago, Dr. Farooq Hafiji used to say a good test would be, you have those low picket fences in Australia, and before you could pee over them, now you can't quite reach there. And that's a sign that you're beginning to have troubles with your flow. So really it's the flow that goes down, and then as time goes on, you have to wait a while before the flow starts, and then it passes, and then it stops and starts. And at the end there's dribbling off, and those are what we call obstructive symptoms, which is one group of symptoms that patients would complain about. And then the other group of symptoms that patients complain about is going very frequently to toilet. When they need to go, and if they don't go quick enough, they're going to mess themselves, and they wake up maybe 2, 3, 4 times at night. And that is a consequence of the bladder becoming dysfunctional because of a long-standing obstruction. Because if you imagine the bladder is like a pump. It's a muscle pump that pushes urine, and the prostate lies beneath it. So the prostate provides the resistance, and so the bladder has to then shine up to overcome that resistance, and in doing so, the muscle thickens, and when the muscle thickens, the capacity becomes reduced, and so they tend to go frequently, and like I said, they then at times can't make it in time. So those are the main group of symptoms which are related to benign prostatic hyperplasia. And as I said earlier on, by and large, to pick up early prostate cancer, it's often an incidental finding.
A question that comes to, does prostate massage work?
Prostate massage scientifically is not used specifically for benign prostatic hyperplasia. It's used in the patients with chronic prostatitis. It's one of the maneuvers that used to be used a lot in the past, but there's no scientific evidence that it actually helps chronic prostatitis. So if we get to the discussion of prostatitis, chronic prostatitis is a very distressing complex of symptoms and very difficult to treat. And sometimes prostate massage does work in some individuals. for the treatment of that particular condition.
Okay, question comes through, says Salams. I had prostate op done around 4 to 5 years ago. Since then I was fine. Recently I cannot hold to go to urinate. When it comes I have to run to the toilet. Why is this happening? I went to my GP and he put me onto Urifen 1 daily. It's not helping.
Okay, there could be a few reasons for that. One is if you've developed an infection for whatever reason, that in itself can be a source of the symptoms you describe, and so they should check your urine either with the dipsticks in the room or send it to the lab. If there's no infection in the urine, then there's one of two reasons. One is you could have developed a blockage along the urotube. So if ever you have any instrumentation to the bladder, sometimes you get a bit of a scar developing along the urine tube, and that causes a blockage, what we call a urethral stricture, and that could give you the symptoms you describe. Or prostate does regrow over time. Over 5 to 10 years, prostate does grow back. And the other issue that can happen sometimes is at the neck of the bladder. In some patients, the healing becomes quite vigorous, and you get what we call a bladder neck stricture that can also give you, and that develops gradually over the time. So it either could be an infection or it could be a blockage either from a stricture or from recurrent disease or from a bladder neck narrowing. So certainly if it doesn't resolve, you need to see your urologist or family practitioner.
And doctor, what foods can one eat to keep the prostate healthy?
So as I mentioned earlier, there isn't too much you can do. They do talk about zinc and selenium and pumpkin seeds, and I think there's no harm in trying those. Whether they really make a difference or not, I think is debatable.
Coming back to our BPH, as we put it, what are the treatment options for BPH, including lifestyle changes and medication?
Okay, so first thing to understand with urinary symptoms is that we have what we call a score. There's a score chart that we fill out, and it's what we call a bothersome score chart. And what we do there is try to ascertain how much of a bother is the patient's urinary symptoms to them. So if your urine flow is slow, but it doesn't affect the quality of your life, and you can live comfortably with that, you don't necessarily need treatment. And the one question that simply put is, if we ask you, if you had to pass urine like this forever, would it be a bother for you? And if you say no, you don't necessarily have to have treatment for that. Then beyond that, if the treatment is bothersome, we start you on medication. And there are a whole host of medications that relax the smooth muscle, and there's tamsulosin, silodosin, the older drugs called doxazosin. I don't want to give the actual company names, but many of you would probably know them. And these are the first-line therapies that we would use in those patients where the symptoms become bothersome. And if they adequately treated with that, then there's no need to do much else. Once you've failed on medical therapy, then there are surgical options, and the gold standards, as I mentioned earlier, is either laser prostatectomy or the conventional TURP. Laser is quite talked about now, and the big advantage of laser over conventional scraping is that your hospital stay is reduced. You often stay at most overnight. The bleeding is less with the procedure, but it's just a different tool to do the same thing, but definitely it has benefits in terms of bleeding and in terms of your hospital stay. It's certainly bigger benefit over the conventional scraping is in the large grains. So they are above a certain size where you have a very big prostate. We would traditionally have done what we call an open prostate operation, where we do an incision and enucleate the prostate from the top for the very large glands, because those are not managed well with the conventional scrape. And definitely in those cases, the laser treatment is superior to that, because it's at most, like I said, an overnight stay, and the outcomes are good. Whereas if you had to have an open operation, you'd be in hospital for 3 to 4 days with a catheter for at least 5 to 7 days.
Let's talk about something that we all are familiar with. This is a PSA test. What is the PSA test, and how is it used to detect prostate issues?
Okay, so the PSA test was developed a long time ago, probably in the late 80s. It's called prostate-specific antigen. It's a blood test where they measure levels of this particular antigen in the blood, and this blood test is specific for prostate. So there's almost no other organ in the body that secretes this prostate-specific antigen. And the normal value for that is under 4. And so once the blood test is above 4, there's a concern that you may have prostate cancer. There are other reasons why you can have the blood test going up. Any infection in the prostate area or urinary tract can cause the prostate blood test to go up. If you've had any instrumentation or catheterization, that would also make the prostate blood test go up. The normal prostate exam in the doctor's room shouldn't change the prostate blood test substantially. So initially it was concerned that that may also affect the level of the prostate, but in fact it doesn't. Once your prostate blood test is above 4, then there is a concern and you need to investigate it further. Having said that, if you, an elderly patient with a lot of additional medical problems, and your blood test is marginally above 4, but the chances of you living another 10 years are not good, you can debate as to whether you should be doing the PSA test at all. And so one of the recommendations for prostate blood test screening is that you should actually speak to the patient about what the prostate PSA test means, what the implications of a high PSA is, and the need to do a biopsy if it's above 4, and if there's a cancer in your age group, what the risk of that cancer worrying you in your lifetime is. And that should actually be done for most patients, especially the older patients, so that they can then decide whether they want to do the PSA test at all. Very similar to when we do HIV counseling. And that's the recommendation that has come out strongly, and I'm not sure if all of us do it properly, but that is how we start off.
Thank you for that, Doctor. We need to take an ad break. We'll continue on the other side of this, inshallah.
Shimmer, sparkle, captivate. Nothing less than a masterpiece. Droplets of gold inspires precious design. Platinum bursts with intricate freshness. And every pure diamond becomes more than just a girl's best friend. Voda Gold Gem Jewelers, where timeless dreams become a reality. We tailor-make designer gold, platinum and diamond jewelry. Trade in or remodel your old gold. Clad yourself with classy name-branded watches. We offer insurance valuation and freezer card calculation. Visit us at 534 Ridge Road, Overport, or call 031-208-9142. Voda Gold Gem Jewelers, manufacturers of fine gold and diamond jewelry.
Are you wondering what you missed on the breakfast rush with Nishal Sarawan? Here's a quick catch-up.
The game works quite easily. All you do is answer 5 general knowledge questions. With each correct answer, you get a chance to flip it. On the flip side, there's a prize, or maybe not. Let's go to question number 2. How many times can you fold a paper in half?
7.
7 times. Correct. Choose a square and
Flip it.
Exclusive to the Breakfast Rush on Radio Al Ansar. Would you like to give Sadaqah 365 days a year? You can with the Al Imdad Foundation's Daily Sadaqah program. Donate as little as R1 a day for a month for each member of your family, up to any specified amount, and receive monthly feedback on where your contributions have made a difference. Visit alimdad.com and download your daily Sadaqah debit order form, or call 0861 786 243 for more information.
Are you or a loved one battling the disease of addiction? Is your family, life, relationships, work suffering due to alcoholism and substance abuse? Zensai Treatment, Recovery and Wellness Center are addiction specialists offering specialized psychotherapy and naltrexone therapy to help overcome addiction. Zensai offers hotel-style facilities to allow your loved ones to regain their dignity and overcome alcoholism and drug abuse in the most comfortable setting possible. Fight addiction. Call Zensai Treatment, Recovery and Wellness Center, the Addiction Recovery Specialist, on 031 563 0751.
You're listening to Medical Files, and our topic for discussion is prostate diseases. Our special guest, Dr. Haroun Patel, a urologist practicing at the Parklands Hospital in Durban. Now, Dr. Patel, questions have been pouring in. Assalamu alaikum, my beloved brothers and the esteemed doctor. Top medical show. There's a medication the chemists have, the name I cannot spell. It's in a blue box for prostate cancer. Please give me your opinion. Jazakallah khair.
Unfortunately, it's very difficult to answer that question because, for one, doctors, as a rule, prescribe medicines, but we don't know what they look like, or often don't know what the packaging is. So, as far as tablets are concerned for prostate cancer, when we use tablets, it's probably prostate cancer that is now progressed to an advanced stage, if that is the case, and not used for early prostate cancer. But beyond that, I can't advise you really, and I think it's best to take the box and go to your practitioner and let him explain it to you.
Another question. Assalamu alaikum wa rahmatullahi wa barakatuh. I had an enlarged prostate and had an op over 4 years ago. They prescribed Cardugan. Should I continue taking it or should I leave it? Alhamdulillah, I'm urinating fine.
Okay, the point of doing the operation is to take you off the medication that you're taking. So if you've had the prostate cape, you shouldn't really be taking Cardugan, but also Cardugan is sometimes used for high blood pressure. So if you're using it for that as well, then I think check with your practitioner. But if it was purely for the urinary problems, you should not need to take it if you've had the prostate off.
Okay, let me just take these questions first. Does drinking a lot of water help to shrink an enlarged prostate?
No, there's no evidence to suggest that. Drinking a lot of water will make you go a lot to toilet and may, if you overdrink. So, often we tell patients drink a lot of water, but I think you also have to quantify how much is a lot. Just an anecdote where a patient came in complaining of going to toilet literally every half an hour. Inquiring, they were drinking 6 to 8 liters of water a day. This is a real patient that I saw, so not hypothetical. So I think you have to qualify a lot of water.
Are there any benefits of doing Kegels exercises?
Kegel exercises are good for patients that have problems with controlling their urine, particularly patients that leak urine, and it's specifically for females more than males. Those that, when they cough and they sneeze and they leak urine, Kegel exercises are good for those because it strengthens the pelvic floor muscles. And then also for patients that may have had prostate surgery and have a bit of leaking issues, yes, the Kegel exercise will help those group of patients to strengthen the pelvic floor to help them retain the urine.
The medication prescribed by urologists is causing reverse ejaculation to the bladder. Any newer medication that avoids that?
You see, most of the treatments that are used for prostate enlargement are smooth muscle relaxing. Now, the process of ejaculation is that the neck muscle closes when you ejaculate, and so the semen comes out from the front. And all of the medications that are used for prostate are smooth muscle relaxants, and so relax that muscle, and so for many patients, the ejaculation goes backwards. Unfortunately, none of the medications work in any other way.
Okay, another question, does taking Nebido causes prostate to enlarge?
Good question. So Nebido is a testosterone supplement that is used. There's a lot of debate about what exactly it does to the prostate, even in terms of prostate cancer and so forth, because one of the treatments we use in prostate cancer is to block the testosterone hormone, in other words, to stop it. And so by inference, one would say that if you're putting additional testosterone, it should aggravate existing prostate cancer or so. But there's a lot of debate around all of that. It probably does have some influence on prostate enlargement, because the testosterone hormones do contribute to prostate function and enlargement, but exactly how and when is not well understood. And certainly blocking of the prostate, the testosterone hormones don't shrink the prostate adequately to improve flow.
Can salt intake harm the prostate?
No, not to the best of my knowledge.
Okay. The next question you've answered adequately, I think, and what type of food is recommended, I think you've answered that. And then the other question, is beef and mutton fine if you've got a prostate problem?
No, specifically no, but red meat in general for general health and even I suppose in prostate cancer disease as well, keep your red meat to a minimum. It's not healthy to eat excessive amounts of red meat in general. For most cancers, you'll find that they talk about animal protein, particularly beef and mutton, not being recommended, but specifically for prostate, no.
Let's talk a bit about prevention and screening, Doc. What can men do to reduce the risk of developing prostate issues?
Okay, look, I don't think there's much you can do to lessen the risk of developing. Like I said earlier on, there's very few factors that you have control over in terms of developing prostate disease, both benign prostatic hyperplasia and prostate cancer. But what you can do is, one, if you've reached close to 50, if you've got no risk factors, or if you have any of the risk factors I discussed early on, then about at 40 or latest 45, you should go and see your family doctor, have the prostate PSA test done, ideally also have the prostate examination done, and then based on what your baseline test is there, you can then develop a plan for screening for prostate cancer over time. And there are various recommendations as to how frequently you should do the blood test depending on your baseline test. Some saying as much as every 5 years, every 2 to 3 years, and beyond a certain age, some would say if your PSA is at this level at 60 or 70, you don't need to do any PSA tests anymore. But certainly you would do them periodically from time to try and pick up a cancer early if necessary. As far as prostate enlargement symptoms are concerned, if you're struggling to pass urine, it's affecting the quality of your life, have it attended to, even if it means you need to have some surgery at some point, because for many patients who struggle along, waking up 6, 7, 8 times at night, wetting the bed, battling along, there are treatments that you can use. And there are some situations where you could end up having to do surgery because the complications, which we never delved into early on, you can block up your urine completely to a point where you can't pass urine at all. The bladder fills up and often patients are in agony, and in that situation you will initially need a catheter and then probably need surgery. Some patients can go into kidney failure because of a blocked, because of a blockage, and the pressure distributed up to the kidneys and causing kidney failure. You can get bladder stones that can develop because of prostate enlargement. So yes, if you're struggling along, have it checked. You don't always need treatment, but at least you know whether you do or don't.
Absolutely. Does saw palmetto supplement prevent BPH?
It's thought to help with, I won't say prevent, but improve the symptoms, and certainly it's still being used. Saw palmetto is still commonly used. Again, most of these, there hasn't been adequate scientific evidence to suggest that it works well, but yes, patients have had saw palmetto, pumpkin seeds, people have had symptomatic relief. So yes, there's no harm in trying it.
What is, Assalamu alaikum, wa alaikum assalam wa rahmatullahi wa barakatuh. What is urethral dilatation?
Okay, urethral dilation is exactly what it says. Dilation or dilatation is basically where you have a narrowing along the urine tube, often what we call a stricture. And so if you imagine a straw that has something tied around the middle and narrowing the inside of the lumen, urethral dilation is where you use a whole variety of instruments where you pass it through to slowly make it larger and larger. So you use a very thin instrument to pass it past the stricture, and then use a slightly bigger one, and eventually you increase the size till you're able to open that narrowing up to what the normal caliber would be.
Does doc recommend using erection vacuum pump, and under what condition?
Okay, it's just one of the many treatments you have for erectile dysfunction, and I think it's a good modality to use. The main advantage being it's more cost effective than most of the others because it's a one-off cost. But it's cumbersome in terms of how to use, and even when we offer it to patients, when they got this notion of using a pump to create an erection, oftentimes it's, they're not very keen on it, but it does work well. It's available. There's a local manufacturer in South Africa that manufactures one, and they're relatively inexpensive when you take it over time, because like I said, one-off expense, and could last you a lifetime. But to be honest, many patients don't quite want the cumbersomeness of using that vacuum pump.
Okay, I've got like 2 minutes left for the show, and I've got the questions pouring in, so I'm just going to rush through whatever I can. Sorry. If you need to squeeze to pass urine to empty bladder, is it bad?
It means you're having a problem, and so there are treatments available.
Okay, can I have spicy food, and will it affect the prostate? And is it fine to wear underwear, or will that also affect the prostate?
Underwear is fine. If you're comfortable with underwear, fine. Spicy foods, no, but they can affect irritation in the bladder sometimes. Not necessarily the prostate, but some patients that may have irritable bladder symptoms like frequency and burning from spicy food. So if that affects your urination, you may not. But not everyone has a problem with it.
Okay, I'm going to ask you my final question. Does silodosin reduce the expulsion of semen?
It works similar to all the others. They all smooth muscle reaction. So many of them will do it to a varying extent, but yes, it may well cause you to what we call get retrograde ejaculation.
Dr. Haroun Patel, I want to thank you for joining me on the program this evening. Alhamdulillah, it's been very, very informative. May Allah subhanahu wa ta'ala accept your efforts and reward you for these sacrifices. I'm sure that you have a message for our listeners before you leave us.
Yeah, the message is that not everything about prostate is doom and gloom, particularly prostate cancer, and not every prostate cancer needs to be treated. So I think often there's a phobia out there for the big C, but just remember that you may not need treatment, and when the treatment is necessary, there are minimally invasive treatments available. Don't struggle out there. Have it checked out. Your quality of life will be substantially improved with the medications and treatments available.
Dr. Harpel, Jazakallah khair once more for joining us on the program. And I want to thank all the engineers at the various radio stations for having engineered this evening, and I want to thank the listeners for tuning into Medical Files. Medical Files will be back with you next Tuesday evening at 8 p.m. inshallah. And from myself, Faisal M.J. Suleiman, I thank you once again for joining me. It's Assalamu alaikum wa rahmatullahi wa barakatuh.
The Watch Doctor for watch repairs.